Hi, guys. Welcome back to Bridging the Gap. This is a space where we are open to discuss and talk about the spaces that comes between individuals and their beauty and wellness. So I personally truly feel like there's a space where we all navigate in terms of things that challenge us and things that we would like to know more of. And people have questions, and I truly feel like there is no genuine, authentic way of responding and truly people finding answers for their questions and also knowing the right source. There's a lot of misconceptions, a lot of information out there. And I truly feel like getting to know someone that you trust, that you believe will give you the answers to the best of their knowledge. I do not proclaim to be an expert in any shape, way, or form. What I know is my truth, and what I know is what has worked for me over the years in my personal journey. And I truly feel like that's where I come into anyone that I meet and anyone that I look up to and I want to learn from, as well as serving the people behind me that want to just learn from me or get to know me on a level as a patient, as a friend, or as a nurse, as an injector. There's so many ways and aspects of Gifty that I truly feel like I am beginning to uncover regarding parenting, wellness, health, aging gracefully, and our own journey. So, yeah, today I am honored and truly really excited to talk to a friend of mine, a dear, dear friend and colleague that we have known each other for a little over 3 years now, and we have come to know each other and learn from each other and grow together. So I'm here to introduce Tiffany Snyder. She's known as Tiff and P because the brand is Gifty and P and Tiff and P, and we are going to be having more professionals join our team. And this is a space where you get to brand yourself and create a legacy and a life that it embodies you and who you are and who you want to be. Fortunately, unfortunately, we live in an age of social media, and people would like to know and feel the essence of who treats them as a nurse injector, and get to know a little bit more about you and your journey. So, with that being said, meet Tiffany Snyder, aka Tiff and P, my co-pilot and my co-injector in aesthetic lab in Modesto, Stockton, and Turlock. So, Tiff, welcome.
Thank you. Thank you for having me.
All right. Can you tell us a little bit about yourself and who you are?
Yeah. So I grew up in the Central Valley. I'm from Turlock. I went to Turlock Christian Elementary through high school, and then I went on to study nursing at Stanislaus. I got my BSN there. I worked at a manual while I was going to school and then as a nurse, and then I went on to do travel nursing for quite a few years. While in my travel nursing, I decided I wanted to go back and get my NP. So I did that. Toward the end of my master's program, I had to come back to Turlock, or really set down some roots to do my preceptorship. And that's kind of how I met Gifty. I was doing my preceptorship full time, and as a nurse, I'm used to working a lot of hours. My hours with my preceptorship was full time, but I was bored with the amount of hours that I was working. So I saw that Gifty had posted a job for a laser nurse, and I really had no idea what that even was, but it looked like fun. So I applied, and it really has blossomed into this whole career in aesthetics that I never would have imagined for myself, but I really feel so fortunate to have landed in this space here, especially with Gifty as my mentor.
Awesome, awesome. So let's rewind a little bit and go back to talk about. Let's talk about Tiffany. And before you became a nurse, you mentioned that you grew up in Turlock and you graduated high school. Did you consider going to college away, or you stayed local?
Yeah, I had applied to some private colleges down in Southern California. I also just applied to Stanislaus, and I had planned on playing soccer in college, and then when push came to shove, I knew what I wanted to do. I knew that I wanted to go to nursing school, and I knew that it took a lot of hard work. So I also knew that soccer, it was the end of an era for me. I didn't want to pursue that in college any longer. So I decided not to go away to college and just stay home so I could really just keep my head in the books and get through nursing school.
Nice. What made you choose nursing?
I come from a family of nurses. So my mom is a nurse. Even on my dad's side, I have aunts that are nurses, cousins that are nurses. My grandmother was an LVN. So truly came from a nursing family. And what really inspired me to become a nurse was my mom was an ER nurse for many years, and she would come home and have all these really crazy stories, and it sounded fun. It sounded like she really made an impact on the people that she touched. And in growing up, we would go to church every Sunday, and one Sunday during church, we had a person in the community just pass out. We didn't know what was going on. She ended up having a cardiac arrest, and my mom did CPR on her and until the paramedics came. And I already knew my mom was a superhero, but just seeing her in action, and then years and years after that, people would come up to my mom, people from the congregation, and they think like, wow, you're amazing. I saw how big of an impact my mom made on those people's lives, the family of the patient that arrested, and then just seeing people come up to her years later. It was really cool. I was inspired to be a nurse like her, and I just to make an impact on people's lives the way she did.
I never knew that story.
Yeah.
And I feel like that's so cool, like to have such a heroic moment in your life where that was a point of connection. That was also a point of, I want to be like my mom. There are so many countless stories about how we all become nurses and how we navigate our career. And at some pivotal moment, I don't call it pivotal, maybe more like shifting moment in your lives where you get to navigate your career. And you and I know that nursing is like a really broad umbrella. It has so many specialties underneath that umbrella that it's such a privilege to have that nursing license. And then whatever you choose to do with it, it's like a whole level of excitement. So tell me a little bit about, you did mention that you worked in a hospital during high school and right after high school and during nursing school.
So when I turned 18, I applied to Emmanuel. I worked there for up until I finished nursing, and then up a year into my nursing career, a year and a half, that's when I started to do travel nursing. But I started out at the bottom of the totem pole. I worked as a patient transporter, and then from there I went and worked as a monitor tech. I got cross-trained to work at the front desk as in labor and delivery. I worked as a scribe. Every job that you can do in the hospital until you become a nurse, I have tried it. It really helped solidify that I wanted to be a nurse. I know when I went to nursing school, there was a lot of people in my cohort that maybe had never worked in a hospital before, and it was all very new to them. And even just having patient experience, going into a room and knowing how to communicate with the patients, I felt very confident in doing that in nursing school. I know a lot of, other people in my cohort, that was foreign for them. So, yeah, I encourage anybody who is going to nursing school, get a job in the hospital to see if you even really like it. That helped solidify for me that I was making the right choice in getting into nursing.
That's incredible. That's incredible. I consider myself a people person, but when I started nursing school, the hospital was something very new to me. I mean, as an immigrant, I came here in 1995, and I was a CNA for a brief period, and I decided to go to nursing school. So as far as a big hospital, and even walking in and look at the magnitude of what's happening, knowing that they're taking care of patients. And then on top of that, you have to figure out how to introduce yourself to your patient, and then be able to talk to your nurse who has that patient and collaborate with them. And then when the doctors make rounds, and it was a whole, like, I don't know how I did it, but somehow we survived it. But it sounds like you had a really great start beginning with your mom, and then with having worked in a hospital. And like you said, having done so many levels of job descriptions in a hospital, truly I feel like that was one of the strengths that you brought to our team when we met and interviewed you. And I wasn't sure whether it was the soccer thing, because I'm also known as crazy soccer mom, very passionately about soccer. And but I thought that was a connection. But truly, the more I got to know you, and the more I got to know the different aspects of you and so much that you bring to the table, from getting to know the patients and then getting to know the anxieties and uncertainty about what's going to happen during the visit. And then you talking to them about what they want, what is the goal for the day, for this objective, for the visit, and then coming up with a treatment plan. And then unfortunately, in aesthetics, we actually get to discuss pricing and budgeting. And if not today, then helping our patients to secure financial, being able to pay for the services that they so much desire to have or need in their life. So with that being said, when you responded to that application on Indeed, what's your impression? Tell me about that journey.
Yeah, so I told you I saw a position for a laser nurse, and really I was just on Indeed, really not knowing if I was ready to apply anywhere. I was looking for something just part-time or really per diem, where I can just pop in whenever. And when it said laser nurse, I figured it meant like laser hair removal. I was just curious, and I don't know, when I applied, I'm very confident when it comes to interviews, because I have interviewed for so many jobs as a travel nurse, so many that I can't even count. And I feel like I communicate well. Like when I make a connection with people, I can't even tell you one job that I interviewed that I didn't get offered the job for. So
That's
I
awesome.
figured that the interview part would go well, but then I was also curious, like, is this something that would be worthwhile for me? What was the hours that they were expecting? I communicated that I was working full time with my preceptorship, so I
Yes.
really had to work around that. That was my priority in getting school finished. But yeah, I had really no expectations. I just wanted to pop in, see what you guys were looking for, and go from there.
That's crazy.
Mm-hmm.
One of the things I always say in life is be open
Mm-hmm.
and be curious and be ready to grab opportunities. So I truly feel like during your interview and when we got to meet you and when you spoke to Dr. Varapa, one of the solid things that I look for when we're interviewing or trying to bring someone on into our circle is them being able to be humble and to be teachable,
Yeah.
as well as having some key elements that I feel like will be crucial to the next phase in our business. So I started lab, as you guys know, is less than 4 years old, and you were, I think, the second nurse license that we brought on board. And so at the time, I was a very new green business person. I still am very new and green. I still get choked up in interviews just because, like you, I have had a lot of jobs and opportunities come to me. I can't even say I have confidently interviewed for jobs in my life. I feel like when I present to an opportunity, I just present with me and what I have to bring to the table. And so when we interviewed you, I felt like the skill set that I regarded as highly as the connection. I also value the fact that you've worked in a hospital for a long time and you can navigate the unsightedness of an emergency room. That means you're a quick thinker. You have great IV skills. The other one that I felt was a connection point was the fact that you were multifaceted and you had been a travel nurse. That was definitely a plus for me because that tells me that as a nurse and as an acute care nurse in a hospital for over 16 years, I feel like travel nurses are like golden. And when you see and you're around a good one, you just know it.
Yeah.
You know it by the way they present. You know it by the way they answer questions. So I felt like whether it was the socket thing or your personality or your history working in the ER, and also as a travel nurse, I felt like those were some of the key things that we were looking for. Moving on to skill sets that we perform in aesthetics. So you, by licensure in the state of California, you have to be a registered nurse, whether an associate degree level or a bachelor's level prepared. We all take the same state board for our license. And then after that, you work in a hospital where you develop skills like IV insertion, communicating with patient, reading labs, understanding procedures, protocols, and all that. And once you master those, then whichever entry level that you start, I think your first, second years, and then you begin to have like an affinity for, like, I think I want to go to the OR, or I think I want to go to the ICU, or I think I want to go to mother baby or OB and postpartum. What was your experience in the hospital before you hit the travel nursing space?
Yeah, I worked at Emmanuel on the surgical floor. So it was like surgical, medical. On a floor like that, you do a lot of skills. So you have more patients, but you get to empty drains, start IVs, start catheters and G tubes. For me, that was a really good setting to develop my skills. So, and especially in working night shift,
Yes.
I know a lot of nurses in just starting their first nursing job. Night shift for me was a perfect time for a perfect opportunity. I was able to really fine tune a lot of my skills, and we all know as nurses, when you're hired to a floor, there's always the what is the word where you have to float.
Yes.
You have to
Yes.
float to different floors.
Yes,
So
yes.
I floated to all the different floors, to PCU, to medical floor, to tele. In floating to a different floor, you're in a new setting that you're
Yes.
not really used to, with
Yes.
new people, new supply rooms. You're trying to figure out where to find everything.
Yes.
That was like a little taste of what travel nursing was going to be
Yes.
like, because I went on after my first nursing job, and I want to say 9 travel assignments I took.
Wow.
So that's 9 different places and hospitals and communities that I've lived in, and that really shaped me. That really shaped me as a nurse. Just when you show up as a travel nurse, and you need to be confident. You need to know your skills.
Yes.
Yeah, of course, you're not going to know where everything is. You're not going to know anyone. But you need to be have those skills
Yes.
to fall back onto. And I don't know. And starting my first travel nurse assignment, that was kind of scary, but yeah, it worked out, and I ended up loving it. Just all of the change, I really did fall in love with that.
That's amazing. That's wild. I have worked in one hospital my whole nursing career. I worked in 3 different departments in that hospital. So I would say I'm a very traditional, homely, grounded, my brain is wild. So because my brain is wild, I need to be in a controlled environment for me to do my best. So I would say that's one thing that really fascinated me when we interviewed you and we brought you on. So going back to the skills from the hospital that we translate into aesthetics, you talk about G-tube, IV, managing the ventilator, different units that you've worked for. What do you think is the skill sets as far as the skills that I had other segments that we talk about soft skills and hard skills. So in nursing, the art of nursing itself is an art. It's something that you have to perfect, and then you add on an element of complexity. So as you've navigated the different aspects of nursing, as you transition to, obviously you become a great nurse and you can travel and you can perform and shift, provided you have the essential supplies to work with. And as you pivot into aesthetics, what were some of the skills that you felt like? Is it being IV insertion? Is it being handling the different needle gauges, the catheters? And this is where you and I really have learned to work together as a co-pilot. And it's cool that we got to bounce ideas. When we talk about nursing and being an injector or being an aesthetic nurse, you have to have the soft skills, get to meet your patients and how you feel to them, and reading into or gathering nonverbal cues about what's going on with them, and then trying to meet them on their level. Tell me a little bit about how you navigated those spaces.
Yeah, so as a nurse, we can, as an experienced nurse, we can walk into the room and really get a feel for this patient, get a feel for if they're sick, if they're, stable, if they're someone we need to keep on our radar to to call the doctor about later in the shift. Just that sort of skill set helps in aesthetics, because we can walk into a room and sense if that patient is anxious, if they're in here for the first time and they're, really going to need a lot of hand-holding and education. That people skill that you learn in the hospital, and having so many different patients and speaking with so many different types of people and their families, that skill is invaluable, especially in aesthetics, because all of our patients here, they want to be here. In the hospital, unfortunately, that's not the same case. They're sick and they're vulnerable. And here, they are their own type of vulnerable. They have a issue that they want to talk about, whether it's wrinkles, whether it's hair, whether it's a recessed chin, whatever it is. They're vulnerable, and they're stepping into this space and wanting to have our expertise. They want education on that, or they want to know what they can do to improve these things. So that those people skills that you learn as a nurse are invaluable. IV skills, I never knew that one skill was going to be so important later in my career. And working as a nurse, I became like the go-to IV girl. Even as a traveler, I would hop into a new hospital and help everyone with IVs. And then even in hospitals, I would get called to other floors to go start the IVs. So that skill became really important in aesthetics too, because we are poking people with needles all day, every day. And just the delicate work that we do with the cannula. We know as nurses, when starting an IV, you have to have like delicate hands to like advance the catheter when starting an IV, and same with using the cannula here. So I love when you and I get to work together, like when I have some time between patients and I can go over and help you, because we know when. Just an example here on Friday, when you're trying to use the cannula and there's some resistance there, I know that I can put some counter pressure on the skin to help you glide that cannula back. I'm sure the girls that work with us here, when we work together, we don't even need to talk. We can just do things to really help each other out. And these girls probably think we're crazy, but it really is a privilege to be able to work with you. And when I'm with the patient and you sometimes hop in and help me, it really is nice to have you in the room when I'm injecting, and I know vice versa, because we read each other's minds, and we can just really, really help the injection process go smoother, whether it's just distracting the patient, talking to them, or helping with those fine little skills. And even using your expertise. Like I can assess a patient and see one thing and be ready to inject. And then you can come and offer a different approach that maybe I wasn't seeing at first. So it is nice that we can bounce those ideas off of each other. Even when you are so experienced, you have years and years and years under your belt. And when I pop in to assist you, you'll ask me, like, well, what do you think? And we really appreciate each other and respect each other and respect each other's the way that we handle patients. So I don't know. That's one thing that I really like about the way that we communicate with each other.
I truly feel like I said in the beginning, you have to know how to feel someone. And I feel like in aesthetics, everyone's journey is so different and unique, and it can be very intimidating for a patient to want to walk in here and ask questions about Botox, about fillers, about lasers, about a comment that somebody made about them, or they want to look good for a birthday. They want to look good because their daughter is getting married. When they walk in and they are nervous, and a lot of aesthetic places, it is a medical facility. It is also a place that it can be challenging for someone to even pick up the phone to even schedule that first appointment. And then once they master the confidence, I guess it even starts subconsciously before that. It takes someone the vulnerability to accept that they are aging and there's something coming up or showing up that they don't like. Then they will do their own research as to wrinkles and skin discoloration, and then all the way up to I feel like my face is falling. And I feel like that's one of the number one questions that we get when patients, for whatever reason, they wake up one day, either for a birthday, and they're like, shoot, my face is falling. Okay, now what are my options? So when they say my face is falling, okay, we got to pick it up. we got to do something. And then they recognize that they want to do something about it. And they do their own research, and then they look for areas to go to locally. We've got patients who go to the Bay Area, people who've gone to Fresno, people who have gone to LA for Botox. And then the next time they wanted Botox, they Google Botox near me. And then when you Google Botox near me, there is over 20, 30, 100 places in our local Central Valley region. So then they do the research, and then they look at the website, and they look at the people who work there. And then they get to see our space and who we are and what we stand for before they even decide to call and book to see you or myself. And then when they book and they get a confirmation, they show up. So in our office, we truly believe that we want to bridge the gaps for patients and people who generally feel like they want to do something about their appearance. I have come to appreciate the fact that we are a medical practice and safety is our highest priority, but more so is how we feel and how the people who want to book to see us as professionals, that they look up to us. And we hope that they do their research, that they research you as nurse injector Tiff, and they look at where you went to school, your experience, and if you are the right fit for them, and then they book to see you. So when these patients come to see you, tell me about 3 of the top things that they complain about or that they want addressed.
I think number one thing that people say is their face is falling, or that they look sad, that they're not happy with the wrinkles up on their forehead. With the mouth, a lot of people say that, like, they look sad and they need Botox for these lines. I think that's one major misconception that we get is people think that these lines here, the nasolabial folds, can be addressed with Botox, and that just takes some education. We don't want to add Botox there. We want to add fillers. I know coming from someone who, before working in this industry, I had never been in this space. Like, Gifty, you and I talk about that a lot, that we're not big girly girls. You wouldn't before you and I were in this industry, we wouldn't have anticipated that for ourselves. I had never had Botox before. I never had fillers. I had Googled before, like, what, these wrinkles on my forehead, what can I do for them? But it can be really intimidating for someone who's never been in a space like this to just come in through the doors. I had never done it myself, but we want people to just feel really comfortable. So we are a medical setting, but we don't want it to feel like that sterile environment where you walk in and it's like at the doctor's office and it's you're nervous. When you walk in here, our office is very just comfortable and warm, and our staff as well, very warm and kind, and we want to give that off to them. Like even when they come back to us and they're nervous, oftentimes I'll just pull my little stool up to them and say, no reason to be nervous. Let's just talk. We're just talking. Tell me like what even brought you in the doors. It starts with a conversation like that, just like sitting down with them on their level and figuring out like what is that what that thing that they're vulnerable about that brought them in the door.
Right.
Yeah.
And then from the complaint or from the little concern, what's your next step after that?
So education, why those lines are there in the first place. So with wrinkles, we lose collagen in our tissue. With we lose bone density. We lose the fat pads that are holding our skin nice and taut. So there's a lot of things that change in our face in the aging process, and it's just about education of why this happens and what we can do to fix it or what we can do to prevent it.
Awesome. I like that. Patients don't know the difference between Botox and fillers. They don't know the difference between a collagen stimulator and a filler.
Yeah.
People I know in my experience that I'm at a point in my career where I see more matured women, and that is a space of approaching the conditions with different modalities. Like you said, as nurses, we start with the syringe and the needles and then the medications and then the catheters. When we are in aesthetics, we have different tools to address different needs or concerns that our patients present with. So beginning with, I have wrinkles. Personally, I start with, you have wrinkles, yes. Which wrinkles bothers you the most? And then once we talk about which ones bothers you the most, and they look like, I give them the mirror, and then they just go everywhere.
Yeah.
Everywhere. I don't like my under eye. I don't like the lines. I don't like the ripples, and I don't know what's happening to my cheeks. And then this is making me look sad. So once you give a patient the mirror, and then you just let them tell you what's bugging you.
Yeah.
We are a practice that we truly focus on not judging
Yeah.
and not pushy with sales, but let the patient be the navigator. We are here to guide our patients and support them to make the right choices. We present them with information and education, and then based on the expectation, we try to meet in the middle.
Yeah.
Once you have patients tell you their story, and one of the questions that I will ask is, how long have you been thinking about Botox? And then, why today? Why now? So once you let them, and then they will tell you, oh, it's because I'm turning 50. It's because I'm going to be 60. It's because my daughter's getting married, or I'm starting a new job, or that I am going on vacation. Those are like my favorite ones. And I feel like we live in a stage in our life right now where appearance is a big deal, and we want to look and feel our best. So from the moment of, tell me what brings you, giving me a sense of you pointing to the areas that you're not loving. That's how I say. And then coming up with options. And then we look at a timeline. When do you want these things to be resolved by? And then we have to look at, okay, if we're on a deadline, what can we do today to to inch us towards the goal of you getting these wrinkles. So we were talking about when patients come in and they obviously have concerns, and they begin to show you areas of their face that they're not happy with. So once you get a sense of 3 or 5 different items, and you feel like the expectation is more like a facelift that they're asking for,
Yeah.
in your treatment process, and as practitioners, we begin with assessment, history collection, and then you put the history together with the assessment, and then you come up with a treatment plan, and then you also look at the expectation if this can be done today.
Yeah.
So tell me how you approach your patient's goal and the vision that they came in with, and then in a step-by-step process.
Yeah. So, for example, if someone came in and the wrinkles on their forehead bugged them, we would start with that education and say, that sounds like a Botox thing. Let's talk about Botox. For these muscles, this is how many units are required for the muscle on our forehead. This is how many units, and those muscles really work together, so we need to treat them both together for the best aesthetic outcome. I always want to address when recommending a dose, I want to know what their expectations are. So do they want 0 wrinkles? Do they want to soften the wrinkles? Is this their first time and they don't want to anyone to know about this treatment? So considering their expectations, then we talk about the dose. And I'd say for most people who've never had this treatment done before, we say 30 units on their forehead or 35 units, and they think, oh my gosh, like let's start with 5 or something. And it's just about that education part of it. So 5 units, as you and I know, is not going to do a whole lot of anything up there on our forehead. There's a minimum amount of units in order for us to see some results. Then there's the recommended dose. And sometimes we like to ease patients in, maybe not getting them on a nice strong dose for their first treatment, because
it could be shocking.
Yeah, and we know that at that 2-week mark we can always add more units. That's easy. That even you and I are pretty good about telling our patients at 2 weeks, pop on in to see us. That way we can make sure that these are the results that you want, because if not, let's add more. And that gives us a good idea of, for future treatments, how many units you will need to get the result that you want. Always in setting realistic expectations. If I say we are doing 35 units, I will educate and say 35 units, you'll still be able to move your eyebrows, you'll still be able to make expression, depending on the patient. Maybe starting at the bare minimum, if they're wanting just to start out with very low amount of units, I will tell them, with that amount of units, you may have some wrinkles left behind, and that's okay. Like, in 2 weeks we'll know for sure, and then figure out your dose and moving forward. A lot of people will not realize on their first treatment that the Botox lasts 3 to 4 months. So in 3 to 4 months, they will need that dose again. It's not a touch-up. It's not that if you come more frequently, you will need less units. It's every 3 to 4 months, once we figure out your dose, that is your dose in moving forward. And we may, as we age, we'll likely need more units. So especially if we're treating a new area. If we start out with 30 units on our forehead, it doesn't mean next time if we treat our forehead and our crows that it'll stay at 30 units. It will likely go up to 40 units or, 50 units. So always setting realistic expectations with our patient is really important, because if we do a conservative dose and then they come in and say, I still have wrinkles, or if they have these wrinkles etched in their skin, you and I are very good about saying, hey, these wrinkles, they are affecting your skin at this point. It's not just muscle. And Botox works really good on muscle. But if it's static lines that are there in a neutral position, we can't get rid of it with just one treatment. It's going to take maintenance. It's going to take consistency. And every 3 to 4 months, getting your Botox. That way, those wrinkles that are etched in the skin can kind of soften over time.
And the muscle memory too.
Yeah, for sure.
And then let's move on to fillers. Once you come to terms that this is no longer, or what they are describing or showing you is no longer a Botox problem, how do you navigate them to talk about fillers?
Yeah.
I know in my practice that people feel like fillers are like a taboo.
Yeah.
And they'll make you look fake. How
Yeah.
do you navigate that conversation?
Yeah, so that is maybe the number one thing people say their first treatment or their first couple treatments, like, I don't want to look fake. I don't want to look like someone I'm not. And that is our goal too.
Yes.
You and I both inject for more natural results. If someone comes in and says, this is the result that I want, and it's not something that we can give them, we're honest with them and we say, hey, we go for more natural results. I like to use the example of my own face or any of the staff that work here. Like, take a look at our face. Most patients would not think that I have a whole face full of filler, but it's done by a good injector and done in very delicate ways to where it just is replacing volume, and the volume that I've lost in the aging process, which is not much. I'm in my mid-30s. It's more prevention at this point. So, I have cheek filler. I have Sculptra in my forehead and temples. I have some filler in my nasolabials, down in my marionettes and my lips. I'm very open about the aesthetic treatments that I get, but nobody looks at me and says, oh my gosh, you look fake, you look overfilled, you look overdone. We go for a more natural result, but sometimes that takes like 7 syringes to get a natural result. And we like to start off slow, but if a patient is needing a lot and their expectation is up here, that this is what they want, we are honest with them and say, okay, that, we don't have to do it all at once, but that's a process that could take this amount of fillers. Fillers are not scary. The fillers, you see it in the syringe and it looks like, oh my gosh, you're going to put all that in my face. But if you squirt out a syringe of fillers, 1 syringe is 1 ml or 1 milliliter, and that's the size of like a blueberry or the size of a jelly bean. And if you imagine the size of half a jelly bean or half a blueberry, when we're wanting to do lip filler, oftentimes half a syringe is not enough to really see great results. Right. It's enough to, of course, make you feel nice and fluffy and puffy right after we do it, because you're going to be swollen from the injection process and from inflammation. But at that 2-week mark, oftentimes if we do half a syringe, especially for someone's first time, they will think, what the heck? My filler just disappeared. Where did it all go? It's in there. It's just you likely needed more. You needed at least a syringe in your lips.
What is the numbers that they say? Is it like 1 ml per decade? There's something like that. We can look into that and talk about that. But more than anything, I'm in my 50s by the time this episode comes out, and I'm also very, very open about what I do. I prioritize the fact that the work that you and I put out at Aesthetic Lab, we want to be very natural. We want to be a brand that stands for authenticity, that we practice what we preach, and I get my facials. I do get my skincare. I'm doing better about that. And I have got fillers, and I get Botox religiously every 3 months. When I say that, people are shocked. Do you do Botox? I thought you don't crack. And I'm like, oh no. I get 150 units of Botox every 3 months, sometimes a little bit more than others, depending on if I'm lifting or if I am on a wellness goal. Personally, I am fully disclosed where in my face I have gotten fillers. When we use fillers, we are replacing volume, we are contouring, we are balancing, and we are providing a very natural look. At Aesthetic Lab, we pride ourselves in more natural, the better. When I look at assessing a patient and they have a concern, especially in their 20s, typically those are concerns that already has to do with ethnicity. For example, having a small lip or a recessed chin or some areas that they feel like they want to enhance. And then people in their 20s and in the 30s, the 40s, and in the 50s. So typically, younger women are more like baby Botox and then lip fillers. And if they want a filler to enhance a certain aspect, if they're insecure about their lips, if they want. So personally, I have gotten fillers to help with my chin projection. My face was very, very round. I do have cheekbones, but I do need a little bit balancing. So other than getting chin fillers, I have done my smile lines and my marionette lines. I've also done my jaw a little bit. I do the masseter Botox to lower and also help with my TMJ
It makes a
and my
big impact.
tension. Yes. So personally, I use multiple modalities, and a lot of people don't know that. That the work that appears, the outcomes are more natural and subtle, are more expensive, or
Yeah.
it takes a little bit more skill set to do. So for you and I to create the natural balance, we don't want to announce to the world that we've done fillers on a patient who is in their 50s and 60s or 70s. So that way we start from the top to bottom. So when we start assessment, we start by symmetry, where we look at the face left and right and make sure everything is symmetric, and then where we might need to balance things off. And then we look at the first third, the second third, which is the mid face, and then the lower face. So the different age spectrums require different areas of assessment and treatment. So personally, I feel like once we start from head to toe, I personally have fillers in my temples. I just had 2 syringes of Voluma placed in my temples. When I start aging or losing weight, it kind of shows in my skull. And where it shows, it doesn't affect my cheek, it just affects my temple. And so I have fillers in my temple. My cheeks are here, nothing in there, because then I'm going to look chipmunky.
Yeah.
So as I'm aging, I have done my jawline, like I said, with fillers, and then also in my chin and smile line. Other areas of your face. And this is why I truly feel like coming in as a patient to come in for consultation and then coming up with a treatment plan. In the Central Valley, Aesthetic Lab is known for having a vibe that is cool. We appreciate being known as the cool girls in the valley. But more than that is also that we pride ourselves in truly knowing what we do. You and I have attended multiple trainings together. So let's talk about some of the things that we do for our skill set that make us stay on top of our game.
Yeah. Always keeping up with like our education, and we recently got back from the Allergan Medical Institute training in Fresno. That was really good. We got to learn about facial balancing, cheek and chin filler. With these companies like Allergan, Galderma, they really work with us to especially when they have a new product out. They want to get it in our hands so that we can play with it and figure out if we like it and see how we can utilize it. So anytime a new product comes out, we know about it, we get it in our hands, we practice. You and I have attended multiple cadaver trainings together, and those ones are my favorite. Those are so exciting. Really to just peel back the layers of the skin and see like what we're doing underneath. So of course we can use our assessment skills. We can always look at a patient, and if there's any vessels that we can see with with our eyes. We're going to avoid them, but in a cadaver training, we peel back the layers of the skin and we see where these big arteries and vessels live that we know we want to avoid. And we know with each patient, we know a general idea of where they live, but there's also always variation. Like every patient is so different. So especially when we're placing filler, there's so many different planes that we need to inject in, and with different types of fillers, there's different planes that we need to inject in. So in the cadaver courses that we've taken, we get to inject the filler and then peel back those layers and see if we're in the right plane. And yeah, it's really exciting.
Safety and results, expertise. Let's talk about us utilizing the needle to create amazing results. Like you said, you were the IV go-to girl. And so in the Central Valley, in aesthetic lab, where we feel like we're in a lab where we create things and we make things come to life. And this is real in what we do. And you cannot have a lab that puts out consistent scientific proven research backed with practice and experimenting and learning to level up your skill. So we in aesthetic lab wants to be the go-to girls for Botox and fillers, for all things beauty, and that our patients will trust us, that we are doing our best to serve them to the best capacity and the industry knowledge that is available to us.
Yeah.
So tell me a little bit about what you do well in aesthetic lab.
I do a little bit of everything here. My favorite thing to do is injectables. So, Botox, fillers, Sculptra, PRF. I really have been loving recently. All of those things. Wait, sorry, cut. What was the question again?
What are the things that you...
Oh, that I do
you can
well.
come back into laser because
yeah.
laser is like you came in as a laser nurse and that's still your passion.
Perfect.
But you've grown to love.
Yeah. So in starting at Aesthetic Lab, I got my foot in the door here working with the lasers. And there's so many different things that we can do with lasers. So laser hair removal, skin resurfacing. I love anything to do with the skin because the skin is what people see when they look at us. And yes. We can do Botox and fillers and any injectables every day, but if our skin isn't in the right place, it's not going to make those other injectables look as good as they possibly can. So right. I love doing the radio frequency microneedling that helps resurface the skin. It helps tighten. It stimulates collagen. I've been loving that treatment right now. Also, of course, all of the injectables. Laser hair removal is a must. Yeah.
So you've done, what procedures have you done on your family members?
On my family members. So I have done Botox.
You took your mom to a training.
Yes, my mom has been to
your model.
Yeah, she's my OG model. We've done her Botox. We've done her fillers. I have done microneedling treatments on my sister. On Emmy, we brought her as a model for laser hair removal.
And Emmy's an athlete. She's a teenager, and she's play basketball, and she does not like the hair on her legs. So we took care of her. And then other friends that live in the area, I've brought them in to be a model for cheek filler, chin filler, lip filler. I think that's... No. You are my go-to girl for my fillers. And
I know. You're my go-to girl, too. You're my beauty bestie.
Yes. Thank you, Tiff. It's truly, this is the beginning of more to come series that we'll be recording from time to time. So as far as keeping up to date to what is coming up in Aesthetic Lab, I think that this is a company that has a vision and a mission to serve. We do serve in multiple levels, in multiple aspects. So I feel like we are here in the Central Valley. We are here to serve as we continue to grow. We are expanding in Turlock, and soon to come is Stockton. We are going to be staffing our offices and locations with the top of the top as far as skill set and product and services to serve you. So you will be, you are the face of Turlock, and I still go to Turlock sometimes, but mainly you are a Turlock girl. So we're going to be expanding, open up. What are some of the services that patients have been asking about in Turlock?
Facials, laser. We run a weight loss clinic at the Turlock office, and that is, of course, expanding. People are excited about that, and just having more room, so more modalities to treat our clients.
Awesome. Super excited to be expanding in Turlock, where that's your home base, you're the home girl. And then in Stockton, you will be going to Stockton a couple of days a week. So that's super exciting. So we are pretty much taking over the Central Valley as the beauty go-to place. We are a full-service premium medical spa. We have a lot of lasers and a lot of services, and we continue to grow. So, guys, look forward to more to come from this series, and truly such an honor to have you today.
Thank you for having me.
Cool.